Hello everyone, beautiful fellas. Today we are bringing together an episode with Gary Rothenberg from Podimetrics, and we are going to talk about some great innovations that Gary and his team are doing at Podimetrics. Welcome Gary, how are you today?
Thanks so much for having me today. Pleasure to be here.
Yeah, and joining us at HLTH, I know you would already be having like brimmed with ideas. I believe we are at the center of innovation today where we are joining from.
It's been a really interesting meeting so far. Been here a few days and sat on a panel, learned a lot, made a lot of connections already. So
Great,
it's been a
great.
good meeting.
Sounds so good. I mean, Gary, really looking forward to deep dive into your experiences because one, you have been, part of building a company, but I also know that you have been a practitioner still, seeing patients every week. So,
That's
yeah.
right.
So yeah, let's start by talking about your work. Like, would you like to give us some background, like about your work, where did you all started, and the purpose you have been working to fulfill?
Sure, appreciate that. Well, first of all, I am a podiatrist by trade. I've been practicing almost 25 years. My career has been dedicated really to preventing lower extremity complications among people with diabetes. I'm currently practicing at the University of Michigan. I'm an associate professor there, and we have a fellowship as well, which I direct. And it's a research-based fellowship in limb preservation. So we're really focused on trying to shift this focus away from treating complications of diabetes as related to the feet to preventing them. That led to my relationship with Podimetrics, which goes back about 10 years now. At the time, I was actually at the VA in Miami practicing with veterans. And we did some of the original research on the SmartMat, which I know we'll get into shortly, the technology that really has been a game changer in the space of prevention of complications. And veterans, so I did some of the research with the company originally, and veterans today still are among the most important clients that we have. I've been full-time in a position of Director of Medical Affairs for Podimetrics for the past year. So my job is mostly involved with education, supporting our nursing team, supporting our sales team, and just getting out the word about connecting patients, providers, and technology, especially in this field, towards preventing lower extremity complications.
Great. Well said. So, tell us more about SmartMat. Why not we deep dive more into that? Like, how does SmartMat and integrated clinical and patient support services,
Sure.
are able to help contribute to this mission?
Sure, happy to talk about that. So, temperature monitoring has been a long studied, really important technology. It goes back to the 1970s. Over 50 years ago, we recognized that feet, including the rest of the body, fever or warmth, heat, is going to predict bad outcomes. So anytime any of us get sick with a virus, a bacteria, you're going to get a fever. Well, the foot can do the same thing. So there was some technology back in the 1970s. Fast forward to the early 2000s, there were 3 randomized clinical trials which showed temperature monitoring to feet on a daily basis by patients themselves in the home could really help predict pending complications. That technology from the early 2000s, though, was not patient-friendly, and it missed a piece of the puzzle, which was really including the provider. So it's really important, again, this triad of patient, provider, and data, and connecting those. And so Podimetrics really innovated that technology, same sound science behind temperature monitoring, but now it was in a much more user-friendly device. So it's a mat, very similar to a bath mat or a scale. Patients step on the mat. We prefer that they do it first thing in the morning. It literally takes 20 seconds.
Okay.
And then through cellular technology, the scan is actually sent to our headquarters, which is outside of Boston. But we have a team of nurses who are monitoring for asymmetry. When the left foot and the right foot temperature are not in sync, that can predict pending potential problems. So the important part is actually when our nurses then call the patient, engage with them, the touch points of finding out from that patient what's going on with their foot. And because many of them have neuropathy, or they have poor feeling in their feet, they don't even realize that there's a potential problem that can happen. So our nurses really help to touch base with them and then escalate to the provider. So again, in between these visits, among high-risk patients with diabetes, which typically happen about every 3 months, at least in most traditional systems, healthcare systems, if you've already demonstrated that you've had a foot problem, typically a podiatrist likes to see those patients on a quarterly basis. But the SmartMat can really help keep eyes on the patient between those usual visits. And it's those important touch points which we believe and we see are really helping to avoid complications.
Great. I mean, that's so interesting because, I'm intrigued by the simplicity of the solution while, the sophistication of the care that it brings.
Well, I think that's what our patients need, right?
Yeah.
They need something in the home that's very easy. And this conference is all about technology and what's coming down the pike with AI. And it's very exciting. And we use machine learning too to understand who's at risk and how to predict those things.
Predictive.
But it is simple at the end user stage, which is the beauty, which is the innovative part of why the SmartMat.
Because I think plenty of the patients for diabetes, for example, if we are thinking they are not the best with their smartphones, you don't want them, or you cannot think of a solution that they'll open their mobile application and tap and 10 things before they get to know what needs to be done and stuff. So
I agree. And this patient population that we typically serve is going to be an older patient population. Things may change 15, 20 years from now when everybody is growing up with a cell phone in their hand. But this generation still, I think there are some limitations. So that human touch point of our nursing team has really, we call it the secret sauce.
Okay.
It's what makes the difference is when somebody is talking, is watching and paying attention, and then when they call you, it's for a very valid reason.
Right.
So healthcare, in my opinion, will always still need that human touch. It's tough.
Or AI that is really human.
That's right. But the simplicity is key, as you mentioned.
So Gary, talk more about, one of your recent articles, in fact, you have highlighted the importance of addressing social determinants of health for patients and with chronic diseases. So tell us more about that. Tell us more about your work into that and your insights.
Yes, for sure. So social determinants of health, I think, again, we're hearing a lot about it this week at this conference. And I think that it's really important to understand our patients are facing 3 major problems. One is access, 2 is cost, and 3 is trust in the healthcare system. And all of those are related to social determinants of health. So I think ignoring those issues is really not helpful towards better patient outcomes. So again, I mentioned I've been practicing for 25 years. I didn't have a course in social determinants of health in medical school 25 years ago. I think we're at least talking about it some today and trying to pull data, which is tough. But we know our patients are struggling with those 3 main issues: access, cost of care, and then trust in the healthcare system. So we're trying to make a difference in that and the human connection and again, having nurses that contact the patients in between their visits with their providers, which is helpful.
So, see, what I understand in simpler terms for Podimetrics that it works with health plans and providers to help prevent amputations associated with complex diabetes. So, tell us more about how this collaborative approach with the healthcare systems is making a difference. What are the impacts, and would love to know some stories or anecdotes that you've seen that got you excited.
Sure. So again, currently our biggest customers is the federal government through the Veterans Administration, and we know that patient cohort is particularly at risk. They're very comorbid. They do have issues with social determinants of health. So we're proud to serve the veterans, and we know that we're making an impact and a difference. I'll share with you also, though, the private insurers and other healthcare organizations, for example, Kaiser Permanente in the Mid-Atlantic group, they did a pilot with our SmartMat program. They originally wanted to do 100 patients. They actually ended up cutting the program short because it showed such significant promise. It was a really interesting design. They had patients on the SmartMat for a year. They looked retrospectively at those same patients and their utilization of the healthcare system. And of course, it's Kaiser. So it's all inclusive there.
Right.
So they had the data of what these particular patients cost the healthcare system in terms of the high risk touch points within the healthcare system. So emergency department visits, amputations you mentioned, hospitalizations. And they looked at that, and the study was really astounding. What they showed is significant decrease in amputations, over a 70% reduction in amputations among the patients that utilized SmartMat. There was a significant decrease in hospitalizations, and it was interesting. It wasn't necessarily only hospitalizations that were related to the foot, it was all-cause hospitalizations. So our nurses, of course, while we are a foot management company focused on preventing foot wounds, when the nurses engage with the patient, we've had plenty of times where the patient literally is having chest pain. And our nurses have called 911 for the patients because they're having
because you are bringing trust.
We're bringing trust, and it's a connection. And it's a call. It's a touch point. So they saw a significant decrease in all-cause hospitalizations, significant reduction in readmissions, which is a big issue for a lot of healthcare systems, as well as emergency department visits. So our colleagues there are seeing significant per member, per year cost reduction in systems that assume risk for these high-risk patients. Again, not take away from the cost, but we know it's also the right thing to do for the patients. So improve quality of life, because the complications after amputation are devastating for people.
So, I mean, that takes them like back on so many things. It's not just losing a limb, but I think it just takes away life from them.
It does. Many people don't return back to their own homes. They end up in skilled nursing facilities. Certainly the relationship among family members, right? I mean, I've been practicing for 25 years. I can't tell you how many conversations about amputation I've had with patients and their families. And diabetes is very much a shared family process. It doesn't just affect the patient, it affects everybody else living with them.
And it's always like a ticking time bomb, I say.
Well, yes, it's a ticking time bomb, and it's going from one episode to the next. So how can we increase the time between episodes that patients have good quality of life and aren't in the emergency room and don't have wounds and can be productive members of society that they want to be? That's our goal. That's our goal.
That's a great purpose that you elaborated on. So, Gary, in your in your profile and your writings, I saw that you have a lot of focus and passion for education, and you see it as a means to a way to increase awareness and how education can play a pivotal role in avoiding disease-related, extreme complications that we look at today. So, share more about that idea.
So again, I practice at an academic institution. I'm at the University of Michigan, run a fellowship program, so trying to influence the next generation of providers. I also am adjunct faculty at the newest podiatry school here in the United States. Is actually in the Rio Grande Valley in Texas, the part of Texas that really dips into Mexico. I thought that was so innovative. It's just 2 years old. The state of Texas recognized the significant burden that there is in Texas among people living with diabetes. And so they opened it's the first public funded podiatry school. And the idea is that the school is there, they're attracting students from the state of Texas, and the whole goal, hopefully, is to be able to retain the medical education and the students so that they will practice in that region and hopefully make a difference, because diabetes is incredibly significantly impacting the Latin community, the African American community, the Native American community, which I hope we get a chance to speak about too. But I know that we talked about social determinants of health. As I mentioned, I didn't have courses in this. I know it's part of the curriculum now, which is great, especially in those geographic regions here in the United States that really need to focus on the complications of diabetes and prevention.
Great, guys. So we'd like to end with your thoughts about the purpose that you have taken up and you've been working towards it. So what do you foresee achievable and dreamy goals for yourself in the next 3 to 5 years time zone, and if there's any ask for help go ahead. Like,
Yeah.
what are you looking for?
Yeah, so I appreciate that. What a lofty question, right? How do we answer that? I will tell you that the mission of Podimetrics is to end all avoidable amputations among people living with diabetes. That's a big goal. But we do know from the literature that probably up to 85% of lower extremity amputations can be prevented. It's our particular mission, and I have witnessed healthcare disparities my entire career. So we understand, again, Native Americans are at such high risk. They have almost 15% of Native Americans are diabetes. We're very proud. We've just launched a survey of Native Americans where we wanted to see the concerns, the experience of the healthcare system. We just launched a survey here in combination with health, as well as yesterday was Indigenous Peoples Day here. The Native American population is particularly at risk. We know that. So we want to end those avoidable amputations. We want to connect the dots between payers, providers, patients, all of those things that can make a difference. I'll share with you one of the most significant statistics that I saw in the survey that we just launched was that 51% of Native Americans are rating their own healthcare currently as either okay or poor. Yet 67% of them thought that their health would improve over the next 12 months. Those things seem in opposition, but I think it's very cultural, and to me that represents hope, right? So I think we have an obligation to act upon that hope. People deserve that, right? And they need access to technology. I'm excited about what the future has in terms of technology, telemedicine, and really making a difference to level the playing ground for everybody. And avoid amputations is my particular passion.
Okay, thank you so much, Gary, for joining us. Guys, here's Gary Rothenberg, Director of Medical Affairs at Podimetrics, and who has a mission and a purpose to prevent diabetes-related food complications.
That's right.
Thank you so much.
Thank you.